Before using patient triage, our patients would access our practice in the standard way. So they'd have telephone access and they would have walk-in access. And that would be based on patients requesting what they feel would be correct, urgent on the day or book in advance. But there was no process of understanding what are the patients that we wanted to see. So it's a very generic process.
In traditionally 10-15 minutes those appointments are gone, and then for the rest of the day it would be either go to the urgent care centre or phone back the next day. So that was the only way they could book an appointment. We had no other online access or over the reception desk. Of course they can come into the practice, but other than that, no other way of getting an appointment. We started to use the Acurx total triage system for a number of reasons. The GP contract changes for this year that stated we can't ask patients to call back the next day, which is exactly what we were having to do. We were almost in a rut with our current system. Patients were frustrated with the system too.
With the resources that we have available, it's difficult to provide everything that's needed. So there isn't really a very good way to make sure that the clinicians were seeing the right patients. On the patient's perspective, it's very difficult to actually achieve an appointment, and if the appointment was achieved, it would be 3 to 6 weeks down the line. So that and being able to see someone on the day for an urgent matter being limited were the main challenges from a patient perspective as well.
Our receptionists told us about how they feel coming into work in the morning because they know there's only a limited amount of appointments available, and they would then be anxious that they know the types of conversations they're going to be having once those appointments have gone.
We recognised that we wanted to try and do better in terms of the clinical outcomes that we're providing, and also the sustainability and experience for our clinicians and our reception staff. I think we talked about how we could go about that. We looked at some case studies of practices using total triage, and we decided it was the right thing for us. The main reason that really drove us there was the fact that we could make sure that patients can contact us guaranteed, without caps, without any extra bars. So it's the first time in my career that I've been able to see the full need of the patient list, as opposed to failed calls and failed contacts by patients at the reception desk. So we wanted to have oversight of that, so we could try and look at making sure that we book in and deal with clinically those patients that require the clinical attention of GPs and ACPs for more minor ailments.
We looked at Acurx. We were already using it anyway because we were using it for the text message service anyway, so we had a look at that. We were really impressed with how to use it, all of the support on their website, and it was just really easy to use.
When using a triage system, what we found really useful with Acurx is the simplicity of the software. So we did have a choice of potential software or systems or processes that we could have used. I think with AccuRx, the biggest win for us was the fact that it's a very light piece of software. It works very quickly. It integrates with our clinical systems, and so for our clinical team it was an additional process, but a very small additional process. There are some software packages which are quite comprehensive in what they might provide, but slower, clunkier, and less easy to sift through 130 triages a day. Using total triage to capture every single inquiry, and again that's a bit of a game changer, because in the practice before there would be different flows for different modalities of access.
Regardless of whether a patient comes to our reception desk in person, phones the practice, or puts the request in on our website or through the NHS app, they all go into a triage form. So it's all going into one pot, which I think is great, because there's no, what we say to people, there's no unfair advantage of whichever way you contact us. Your receptionist filling out the triage form on behalf of somebody, if it's over the phone or at reception desk, and we have a admin person who is managing that inbox. As there's always two people in the hub, as we call it, the triage hub, which is one clinician, one admin person every day. We do share it out between our clinicians, and they are given time on their clinical rota. So if it's one of our ACPs or a salaried GP, they will get some time, maybe an hour or 30 minutes in the morning on their rota. So it's instead of seeing patients coming in for a face-to-face appointment, they will be doing the triage.
Myself and some of the senior clinicians will then go through that process. We can then prioritise the cases that need to be potentially reviewed on the day for urgent matters, and we can set plans for other cases that aren't urgent for the day. And in doing so, we can provide access on the day for the things that require it. We've reduced our waiting times for routine appointments to around 2 weeks, 2 to 3 weeks, where we need to bring people in on a non-urgent manner. And we've been able to spot red flag symptoms, so things like cancer symptoms, which normally in the system would have waited a lot longer, but actually from a clinical perspective, those are highlighted, same day review, same day 2 week wait, and that's going to improve outcomes in the longer term.
The morale of the team has changed completely. It's so lovely to see. People are happier at work, calmer, less stressed. It's just been, as I said earlier, a game changer for us. The reception team just said they feel happier coming into work because they don't have to say anymore that there isn't any appointments. They can just fill out the request form. They have a script of what they have to say to the patient to safety net them. From the clinician's point of view, they said their working day was in a better order because the people who are going into their consultations have already been triaged. So for them, the people they're getting in, it's almost like they know what's coming in because they can open up the patient's notes and see the triage request, so they can read what the patient has come in for.
All of the clinical feedback from our clinicians is incredibly positive. It's doing the job that needs to be done, and job satisfaction is much better because of it.
Managing those patient requests is way easier, and sending out a booking link, that has just been a game changer for us and for the patients, because they want to choose what time they can come in. They want to be able to look at their day and think, oh yeah, well that time's going to be better for me because I've got something else on. Summarising
our experience, I think the biggest benefits are from your staffing perspective. You achieve more sustainability. Our clinicians are happier, the workload is more appropriate, their job satisfaction is better. Our receptionists are over the moon. The friction at the front desk has gone. Conversations are much more straightforward. Our admin team are happy that their workflows are now in one particular list, I suppose, instead of the multiple pathways that were present before. They can manage their day. Patients are happier because they can actually leave a query as opposed to trying to get through and work up probably a random system of whether you're lucky on the day or whether you're not. The biggest thing I think from a practice perspective is that as an organisation we can deliver what we were always contracted to do, which is improve the health of patients across the population. So if we can triage and see those patients that have medical need, if we can plan follow-up in appropriate timeframes so our clinical rota forward-looking is used the best that it can be, and we can gauge other pathways that patients can use, that has enabled us to be managing urgent, routine, and carving out time for long-term condition optimization post-COVID. So we've been able to ring-fence clinicians on different streams, which are actually what we should be doing instead of being reactive.